The NHS 111 service is a telephone service available to people in the UK who require medical advice or assistance but do not require emergency medical care. According to the latest data from NHS England, the most common types of calls received by NHS 111 service are related to urgent care needs. In 2020, urgent care needs accounted for around about 60% of all calls received by the service. These types of calls included chest pain, breathing difficulties, and severe abdominal pain. Other common reasons for calling NHS 111 service include mental health concerns such as anxiety and depression, skin complaints such as rashes and allergic reactions. Mental health concerns accounted for around about 6% of all calls, while skin complaints accounted for around about 5%. In 2020, there was a significant increase in the number of calls relating to COVID-19, including suspected cases and concerns about exposure to the virus. These types of calls accounted for around about 12% of all calls to the service in 2020. The 111 service can also arrange for home visits from GPs or other healthcare professionals when appropriate.